Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about a disease that causes sudden, intense, and a lot of pain in the middle of the night and has been caused the disease of kings. But it affects more than just royals. We're talking about gout, what it causes, who's at risk, and how it can be treated. Joining me today is Dr. Bryn Henderson, an expert in regenerative and integrative medicine, to help us unpack everything you need and what you need to know about gout. Let's start with the basics. Dr. Henderson, what is gout?
Gout is a type of arthritis caused by too much uric acid in the blood. When the levels get too high, the uric acid can form sharp crystals. They're like razor blades that deposit in joints, most often in the big toe. It also can affect the other areas, like knees and elbows and wrists. This causes sudden pain, swelling, and redness. It can strike without warning, and the pain can be very severe.
Why do people develop high uric acid in the first place?
Good question. Uric acid builds up when the body makes too much of it or can't get rid of it fast enough, mainly through the kidneys. It comes from the breakdown of substances called purines, which are found in many foods like red meat, organ meat, seafood, and alcohol. But beyond diet, genetics play a major role in how our body handles uric acid.
Speaking of genetics, how much of gout is actually inherited?
Quite a lot. Studies show that gout can run in families. Some people inherit genes that affect how their kidneys handle uric acid. For instance, if a close relative has gout, your risk nearly doubles. Certain gene mutations can also lead to early onset gout, especially in men.
What happens in the body when a gout attack strikes?
Well, when those uric acid crystals settle in a joint, and they're like razor blades, the body sees them as invaders and sends white blood cells to attack. This triggers intense inflammation, causing redness, heat, swelling, and sharp pain. It usually starts suddenly, often at night. The big toe is a classic spot because it's cooler than the rest of the body, making it a prime place for crystal formation. But that is the biggest misconception. Although the big toe is a classic place for gout to strike, gout can affect many other joints too. It's not just a toe problem, it's the ankles, the knees, the elbows, the wrists, and even fingers. Gout often chooses joints that are farther from the center of the body and cooler in temperature. That's why it favors the feet and hands.
I have to tell a story about myself and gout. I was an intern in a hospital, and I don't know if people know this, but when you're an intern, you rotate through all the different types of medicine. And so I was in internal medicine. And my attending physicians had me go and stick a needle in somebody's knee that had gout, and I had to pull out the fluid and then go look under the microscope. So when I first looked under the microscope, I thought I was looking at the game Pickup Sticks, because it was all these tiny little needle-like things that were overlapping, just as the game when you were a child and you threw the sticks down and you didn't know how they were going to land. That's what it looks like. It looks like needle, the type that I was looking at. And of course, there's more than one type, and the needles look different. But that was what I always like to tell my patients. The reason it hurts is you've got about 20 needles in that one little area of your knee or your toe or your ankles or wherever. The pain of the patients, or the men especially, it's like the pain of labor. They're crying. So are there things that could trigger these painful flares?
Absolutely. Common triggers include drinking alcohol, especially beer, eating high purine foods like shellfish or liver, Dehydration is a trigger, and even sudden weight loss. Stress and illness can also set off a flare. It's important for patients to know their triggers.
How is gout diagnosed? What can you tell us about the doctors are looking for? Obviously, you mentioned uric acid.
Well, the symptoms are often classic. The gold standard for diagnosis is actually seeing those crystals you're talking about under a microscope with fluid taken from a joint. Blood tests for uric acid and imaging like ultrasound can support the diagnosis, especially when tophi, that's the hard uric acid lumps, form. But there's good news. The faster you treat it, the better. Within 24 hours is best. We typically use anti-inflammatory drugs like NSAIDs or colchicine or steroids to reduce the pain and the swelling. And it's also helpful to rest and elevate that joint. Stay well hydrated and avoid alcohol.
All right, you mentioned colchicine. A lot of people who have gout now are on colchicine. So you're saying it's an anti-inflammatory drug. How does colchicine work for the patient, and who should be on it besides being on NSAIDs?
Well, colchicine now, its use has been expanded because of its adaptability to any inflammatory process, and it's well tolerated. It's been approved by the FDA for decades, and we're very cognizant of all the pharmacokinetics of colchicine. It's a very safe drug.
All right. So what is the long-term management versus short-term management?
Oh, that's a good question. Long-term control focuses on lowering the uric acid. Medications like allopurinol help reduce production. We also encourage dietary changes, cutting back on alcohol, sugary drinks, and red meats, adding more fruits, veggies, and low-fat dairy. Of course, staying hydrated is key.
So what are the natural and alternative approaches that help with gout that one may want to peruse?
Well, a good place to start probably is with the traditional Chinese medicine. Acupuncture has been shown to reduce uric acid levels, pain, and inflammation for hundreds of years. Some herbal formulas also support the body in balancing uric acid naturally.
What role does our early life or our prenatal factors play in gout?
Interesting studies show that being born with a low birth weight or to mothers with diabetes can increase your risk of gout later in life. These early developmental factors can affect kidney function, metabolism, long before symptoms appear. So gout risk might start even before we're born.
All right, we've heard of advanced therapies like peptides and stem cells. Are these used for gout now?
Absolutely. They're emerging as very solid options, especially the peptides. BPC 157 is used commonly because it's an anti-inflammatory. Stem cells, exosomes, they follow peptides and are particularly exciting because they help calm inflammation and they repair tissues. They fix it, but they're still in the early stages of research, so we'll keep a close eye on them.
What about platelet-rich plasma, one of my favorites? Is that useful in gout?
No.
Oops.
PRP is, well, that's a good question. But PRP, remember, works because it's inflammatory. It works with inflammation. So it's not recommended because it triggers the flares. And it can cause more inflammation, especially if the joints have a bunch of crystals in there.
All right.
So PRP is not considered as safe, and peptides are way more effective.
And prolotherapy would be out too.
That's right.
All right. So is there a way to monitor gout and catch the problems early? I mean, obviously, if somebody knows they have gout, do they do regular uric acid tests, or what do we do here?
Well, good question. We monitor the uric acid levels regularly, especially when starting medicine and titrating them. We also track symptoms, flare frequency, kidney function's a big deal because you either store it or you got to get rid of it, and that impacts the joint health. At our clinic, we follow a structured monitoring plan, educate the patients on flares, hydration, diet, and ask them to keep a log so we know what is the impact of their behavior.
All right. So in a regenerative medicine clinic like you have told us how you approach gout, but review it again.
Well, we combine the traditional and the integrative methods. Beyond medications, we use acupuncture, nutrition, and lifestyle coaching. Big deal is this lifestyle coaching. In some cases, advanced therapies like peptides can also be used. We also explore exosome-based treatments. Our goal is personalized whole-body approach to managing gout long-term.
Dr. Henderson, before we wrap up today, could you leave our audience with something practical, maybe the way to remember how to take care of their health that we do our mnemonic?
Absolutely. It's a simple mnemonic. It's called Gout Relief. And it's a memory tool for patients to help them stay on top of their gout treatment and avoid painful flares.
What does the G stand for?
Get hydrated. Drink plenty of water until when you void, it's clear as water.
And the O?
Opt for uric acid lowering medications like allopurinol.
U?
Use anti-inflammatories. NSAIDs, colchicine, and steroids during the flare can relieve pain quickly.
T?
Track your triggers. Know what foods, drinks, or habits might cause your symptoms.
R?
Rest the joint during flares. Elevate those swollen joints. Avoid pressure to reduce inflammation.
E?
Eat low purine foods. Avoid the red meat, shellfish, sugary diets, and alcohol, especially beer.
L?
Lose weight gradually. Slow, healthy weight loss reduces uric acid levels safely.
I?
Include cherries or vitamin C. Both may help lower uric acid naturally.
E?
E is exercise regularly. Stick to low-impact exercise like swimming and walking.
F?
Follow up with your physician. Stay on track with checkups and blood tests to keep gout under control. Following these simple steps can truly make a big difference. Gout doesn't have to have control of your life.
So if someone wants to learn more about gout, what can they Google? Where can they go for a resource?
They can visit the American College of Rheumatology website at www.rheumatology.org. They offer trusted resources, guidelines, and support for patients and providers managing gout and other rheumatic diseases.
Well, we learn the gout may come on fast and furious and hard, but with the right care, it can be managed and even prevented. From medication and diet to acupuncture and these new promising regenerative therapies, the future of gout care is full of hope. I want to thank Dr. Henderson for his expert advice. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.